Hi there, fellow healthcare providers. Welcome back. I am Shane Grindle, bringing you the cutting edge of medical knowledge. I am a family nurse practitioner, and I am going to help us dig deep into the biochemistry of two potent peptides in the fight against obesity. They are known as semaglutide and tirzepatide. If you are ready to jump right into it, you know what to do. First up, semaglutide. The drug belongs to a group called GLP-1. Now, this is one of the earlier GLP-1s or glucagon-like peptides. It's a hormone that the body usually produces in your gut that helps regulate appetite as well as the insulin secretion that happens in your body, which happens as a response to carbohydrate intake, right? So semaglutide acts like this hormone, meaning that it curbs your appetite, which drops your hunger, and it also helps your body both create insulin and use it more effectively. Semaglutide has a unique structure that allows it to resist degradation by an enzyme called DPP4. This means that it can stick around in the body much longer than the natural GLP-1. So this allows this to be injected just once a week, and so it can continuously exert its effect on the body. However, semaglutide is not for everyone. It can cause side effects, most commonly nausea and diarrhea, especially when you first start taking it. These usually go away as your body adjusts to this new way, but it can be bothersome to certain patients, so just be mindful of that. Importantly, it's not recommended for patients with history of medullary thyroid carcinoma, as well as multiple endocrine neoplasia syndrome type 2, MEN2. If you have those specific types of cancer, you're not a good candidate for this one, as well as a relative contraindication called pancreatitis, where that pancreas can be inflamed as well. Moving on to tirzepatide, which is another novel GLP-1, GIP-1 combination medication. You may know it also as Mounjaro. Tirzepatide is interesting. It's a novel medication, first drug in its class, to where that it combines GLP and GIP. So GIP is glucose-dependent insulinotropic peptide, right? It's another hormone involved inside of insulin release and fat storage. So this particular peptide activates both, like I just said before. And so it helps promote insulin release, decreases glucagon secretion, right? And so it reduces food intake, helping control blood sugar levels, which will also promote weight loss. So you can see how this is more potent, and there's a synergistic effect that we call it that really helps the body regulate insulin and sugars and carbohydrates much better, as well as a beautiful added benefit of weight loss. This medication is one of my favorite drugs for diabetics. If it wasn't so cost prohibitive for certain patients, then I would just have it as a first-line medication, but that's neither here nor there. Like semaglutide, tirzepatide have been designed to resist DPP4 degradation. So this again is only a once a week injectable. The most common side effects are similar to semaglutide, and it's mostly GI related, such as upset stomach, indigestion, acid reflux, and constipation. So not to worry, these typically go away after a while. It's just your body getting acclimated to this new way of processing things with this high GLP and GIP, which is good, right? So it's always crucial to consider the patient's individual risk profile to see if they're a good candidate for this medication. That's where it's very important to speak to your healthcare provider. Great news is that it's very well tolerated, and there's very minimal contraindications, or the big fancy word we say it, for patients that can't take the medication, right? So there you have it. I have just broken down tirzepatide and semaglutide in a way that I hope you can understand and process. These are the new kids on the block as far as diabetes and as far as weight loss. We are in the golden age of weight loss. I'm so excited to be here. And so there you have it, a deep dive into these great medications, talking about the biochemistry and the pharmacology. If you find this helpful, please give me a thumbs up. That lets me know that I'm doing good work. If you'd like to see something similar to this one, give me a comment down below so I know what content you guys like or dislike. Please subscribe and hit the bell button so you know what you're getting each week, and that helps me and helps support the channel, and I really appreciate it. Thank you for joining me today for staying tuned and talking about this new medication with me and these great things. I'm really here to empower the healthcare provider and the patient alike. So as always, I've been your favorite nurse practitioner, Shane Grindle, and I look forward to seeing you on this next video adventure, guys.